First tonight, Governor Gina Raimondo says Rhode Island is holding its own in the fight against coronavirus. I'm Shannon Heggie.
And I'm Mike Montecalvo. Today, the state reported its lowest daily number of new coronavirus cases in weeks, and the number of people in the hospital remains unchanged from yesterday. While the governor says the state isn't seeing a decline yet, so far there hasn't been a sharp increase.
Unfortunately, the virus continues to claim lives in Rhode Island. The Department of Health says 6 more people have died. All of them were either residents of nursing homes or congregate living facilities.
And the Rhode Island Department of Health reporting 218 new cases today. Governor Raimondo once again says it's vital that Rhode Islanders obey the stay-at-home order.
In Massachusetts, Governor Charlie Baker extended the state's stay-at-home advisory, the closure of non-essential businesses, and a ban on gatherings of 10 or more until May 18th. Eyewitness News reporter Kim Kalunian joins us live with how Governor Raimondo responded to Baker's decision. Kim?
Well, Shannon and Mike, that 218 number is the lowest daily number of new cases that we've seen now in 3 weeks. And today, state leaders say they continue to be optimistic about easing restrictions next month.
With new cases on a multi-day decline and other numbers holding steady, Governor Gina Raimondo remains hopeful Rhode Island's stay-at-home order will end on May 8th.
You may have seen earlier today that Governor Baker of Massachusetts renewed the stay-at-home order until mid-May. I would really like to not have to do that here in Rhode Island, and that's going to depend on the people of Rhode Island staying hunkered down for the next couple of weeks, obeying the stay-at-home order.
Tuesday saw the state's lowest number of new cases since April 7th, just a day after Raimondo unveiled her multi-phase approach to reopening the economy. But Dr. Nicole Alexander-Scott says these daily totals are simply a snapshot, and results could be impacted by factors like the weather or which groups of people, like healthcare workers or congregate care residents, are being tested that day.
Someone could get tested today, have a result, and then have a different result or outcome the next day if they are exposed to someone. That type of understanding is why public health guidance is important as we move forward.
That public health guidance carefully intertwined with the state's metrics to move from one phase of reopening to the next.
There is a relationship between economic health and physical health. It is much harder to maintain your physical health if your economic health is so compromised. So while I will never do anything in aid of our economy that our public health experts think is dangerous, but it is also important to realize that there is a balance here.
Also today, the governor announced the arrival of some new PPE, personal protective equipment in the form of hospital gowns donated by locally based Merrow Sewing Machine Company. Now, she also announced an executive order that has some new guidance for health insurers. We'll break that down for you coming up at 5:30. Reporting live at the State House, I'm Kim Kalunian, Eyewitness News.
Today, Governor Gina Raimondo announcing a 90-day extension for licenses, car inspections, and registration set to expire next month. She'll also announce new guidelines for health insurance.
Eyewitness News reporter Kim Kalunian joins us live with those new guidelines and what they mean for your health care. Kim?
Yeah, Shannon and Mike, the governor signed this new executive order aimed at making it easier for folks to get access to health care right now and also making it simpler for providers as well. Here's what she says is in that order.
Number one, I want all patients to know, all Rhode Islanders to know, that their out-of-pocket costs for prescriptions will not increase during this time, and that the medicine you are taking now cannot and will not be dropped from coverage. So from now until May 27th, insurers cannot make changes to what drugs they will cover unless the changes benefit their patient and the doctor says that that's what's necessary. Secondly, I want to make a note about provider referrals. We all know what a burden it is for primary care doctors to provide a specific referral to a patient so that patient can go see a specialist to receive specialty care. As a result of the EO, insurers are going to have to relax this process to allow much more time and leniency. So there will be no referrals needed for telehealth, which is currently a major source of community care delivery in the state. Additionally, I want to make a note about pre-authorization. I have ordered in this executive order that inpatient hospital and rehabilitation, long-term care, and telemedicine in-network services not be suspended because someone doesn't have prior authorization. Additionally, there'll be no prior authorization required for testing and treatment of COVID-19. Behavioral health care. As I say every day, this virus is taking a toll on all of us, and being able to seek mental and behavioral health care is just as important as physical health care. So, at this time, due to this executive order, no referrals or other benefit review approvals will be needed for a patient to access needed mental and behavioral health care.
Now, this executive order will remain in effect until May 27th. A programming note, the governor's daily press briefing will move to 2:30 tomorrow, which has been typical for Wednesdays. We will still bring it to you live as it happens right here on WPRI 12 and on WPRI.com. Live at the State House, I'm Kim Kalunian, Eyewitness News.